We are working very hard with members of the health profession and also members of the community of men who have sex with men to actually address this and get the case well, make sure that we don't have an outbreak in Bermuda. It's important to know that there's a lot of work that's going on at the moment with colleagues to do this. In terms of risk to the average person or the community, it's not very high. It's not COVID. It's not really transmitted primarily by respiratory means. It's usually by prolonged contact with somebody who is infectious. So again, the asymptomatic transmission is not being well documented in this, like you would find in COVID. Most people who transmit this are infectious and asymptomatic. So that allows us a little bit of leeway to be able to plan for this. The other, so we are working, as I mentioned, with healthcare staff to know what to recognize. We're working with essential staff at our borders to know how to recognize this in our passengers coming in and out of the country. We're also working with the members of the LGBTQ plus community to understand how they can protect themselves and protect others by this. The other things that we're working with is training for people like that you might not necessarily think of at first instance. So people like hotel cleaners who have to change linen. Those are demonstrated ways of that the virus can spread. So those are the kind of things that we're putting in place to control this on island. I must emphasize that we only have one confirmed case on island. We have done extensive contact tracing. There's nothing to show us that there's an ongoing spread on island. But we're only as good as our last case. So people need to, yeah, absolutely take this seriously. If you are ill, if you have a fever, if you have a rash, please get tested and isolate until you've been given the all clear.